All right, good afternoon and welcome everyone. My name is Meg Beyer. I am part of the MCTAC, the Managed Care Technical Assistance Center team. I'm thrilled to be joined today by a number of our OMH partners. I'll go through who our presenters will be today shortly. And I just want to welcome all of you and thank you for joining us for this really important critical webinar, Telemental Health Guidance for MCOs during the COVID-19 state of emergency. So a few things before we dive right in today. If you've joined us for MCTAC webinars before, some of this is going to sound quite familiar, but we are recording this webinar, and the recording along with the slides will be made available. You'll be receiving it via email, and it will be posted to the MCTAC website, so you'll be able to view it and share it with your colleagues afterwards. We are also encouraging our partners who are joining on the line today, our MCO partners, to chat in any questions that they may have. So if you have questions at the beginning of the webinar, the middle part of the webinar, please just chat them in. MCTAC is collecting everything, and we are saving time at the end of the webinar to ask the questions of our state partners who will be presenting. So please use the chat box functionality. It should be on the right-hand side of your screen. And I would encourage you, if you can, to select the drop-down when it says send to, and send it to either all panelists or the host. I think either way, that way we can collect everything, but I would recommend that you send it to the host or all panelists. So with that, I just want to thank you again for joining us and say that we are joined today by our OMH partners, including Gary Weiskopf, Alyssa Alshul, Nicole Haggerty, and Amy Smith. They will be presenting on our slides today and walking us through different components, and also will be part of our question and answer section at the end. So with that, I believe my intro is done, and I'm going to pass it along to our state partners to take things away.
Hi, this is Gary Weiskopf. Thank you, everybody, for joining us today. I know everybody is really busy and there's a lot going on. Why don't we go to the next slide? Okay, so I assume that everybody knows, but the whole point of this webinar is really to just make sure and to tell how this is working, that MCOs must pay for telehealth. That's as per the governor's executive order. There was also a specific Department of Financial Services circular number 6 about this. And of course, in the MCO's Medicaid model contract, there's language in 1512 that requires that all OMH services be paid for through telehealth, and we have a government rate requirement, so it has to be paid at the same rate as services we paid for on site. So that's just the background for this webinar. Why don't we go to the next page? And really the important thing, and what we're going to be talking about here, is that for the extent of the emergency, we have declared that telehealth includes telephonic. And for most of the services, where it's appropriate, we're allowing the use of telephonic service delivery for services that are licensed, designated, or funded by the Office of Mental Health. And it's really, really critical that this be done because so many individuals who receive services may not have access to a computer or video. And we really want to make sure that services are provided as broadly as they can be to as many people who can receive them and try and ensure continuity of service delivery. So video and audio for sure for Medicaid, and telephonic over the telephone, audio only is fine and is allowed. And as we go through this, you're going to hear more about what the specific rules are in each of the different services. And then if you have any specific questions, let us know. Essentially, the key part of this is that the rules for billing are identical, whether it's telemental health, like telephonic or video, as they would be as if they're on site. We did everything we could to try and make sure that billing systems, codes did not change. You'll see some additional modifiers for telehealth that are going to have to be added. But what we're really trying to get across here is that we're trying to keep things as straightforward and smooth as possible. We can go to the next slide. Alyssa, go ahead.
Yep. And so we have sent out notification to plans on this topic, pretty much covering everything in this slide, but we wanted to take the opportunity to remind plans that during this crisis, it's critical that plans are complying with the OMH guidance. We understand that there's also a lot of DOH guidance and other guidance out there right now, but for our licensed programs and designated programs, those programs should be following the OMH guidance, and the plan should be following the guidance as well. So in the initial implementation of this new guidance, we did hear that some plans were asking providers for supplemental documentation, things like copies of state-approved telemental health attestations and things like that. And we're just here to kind of remind plans that you shouldn't be asking for that documentation. We really want to make sure that providers don't have any unnecessary delays to being able to provide and be reimbursed for services provided during this emergency in order to make sure that individuals have continuity of care and can receive services during this time when services are really needed. So we wanted to just remind plans of that. And we also wanted to, ask that plans not add any additional billing procedures. We've also heard of some plans asking for additional revenue codes or giving guidance that's not completely in line with the OMH guidance. And we're asking that plans do not do that. We ask that you configure your systems to the guidance that OMH has. The link here on the slide will list all of the appropriate modifiers for all of the OMH licensed and designated programs, and we ask that you configure your systems and accept those modifiers without any additional requirements. And also, before I move on, sort of related, I just wanted to kind of have a quick plug for a response to a MCTAC request that went out to plans. So we sent out through MCTAC a request to know if any of the plans have made changes to their standard procedures for behavioral health services. So this would be the OMH and OASIS services. And we're just asking for your help in responding to MCTAC by Thursday COB, because MCTAC is going to be compiling a resource for providers so that providers know that if plans have had changes to their processes during this time, that they would all be able to access that in one streamlined document. We have heard that some plans are waiving requirements during this emergency, so that would be really helpful for us to kind of get your feedback on, and that we can provide that to our providers. So just a plug to get back to the email. I believe the email came from Meg. So.
Okay, you can go to the next slide. Thank you. So just a couple of important things to note about the telemental health guidance that has been issued by OMH to date. The guidance only applies to our OMH licensed, funded, or designated programs and services. The telemental health guidance supersedes any other state-issued telehealth guidance for OMH programs. The guidance does not apply to private practitioners, and the guidance only applies for Medicaid reimbursement during the declared disaster emergency. Next. And as was already touched on a little bit earlier by Gary, we expanded several definitions of telemental health during this time, during the COVID-19 state of emergency. So telemental health for Medicaid reimbursable services now includes telephonic and or video. So that would include smartphones, other devices that are commonly used. And we also expanded the definition of telemental health practitioner. So it's now including professional, paraprofessional, or unlicensed behavioral health staff who would be delivering a qualified service via telemental health. And there's no limitations or restrictions on the location of the practitioner while they're providing these services via telemental health. OMH licensed designated programs can deliver the services through phone and video using any staff allowable under their current program regulations or through state-issued guidance as medically appropriate. Next.
Thank you. This is a complete list of OMH programs and services that are covered by the OMH telehealth guidance. As you will see,
some of these services are not covered by Medicaid managed care, but for folks who have specific questions about things like, does telehealth cover a PROS or an ACT program and the staff that are employed by those programs? The answer is yes, and the telehealth guidance outlines each and every one of those services. You can go to the next.
Okay, and so just to highlight a little bit of what we've done with the guidance to date. So we originally issued our guidance back on March 11th, and the primary goal at that time was really to get a rapid approval so that our providers and practitioners could very quickly get an approval to offer telemental health services. They no longer would have to follow our traditional process for doing so. And then we made some updates on the 13th where we expanded the definitions, as we mentioned before, for telemental health and for what constitutes a telemental health practitioner. And then just recently on the 30th, we consolidated all of our guidance documents, the telemental health guidance documents, because there were separate ones based on program type and who was delivering the service, and we wanted to just get everything into one document so that it would be easier. Along with that guidance, there's also a self-attestation that needs to be completed, and that's done by the program or the agency. So they're submitting that to us. They're attesting to a number of things that we've outlined in terms of how they'll be delivering the services, and then they're approved effective immediately. And anybody that has submitted any attestation, like any form or version, those are all considered current and valid. Next.
This is a simple link to the OMH guidance page that includes additional guidance beyond just that of telehealth, which is what we're mainly focused on today. I think we've been encouraging and will continue to be encouraging providers and MCOs and other stakeholders to regularly check the OMH/guidance webpage. That's a place that we keep programmatic guidance, as well as things like infection control procedures and telehealth and frequently asked questions that we are working on daily to update and post. There's also DOH guidance. Specifically, we're citing the Health Homes guidance that was issued on the 14th of March. This details that face-to-face requirements are waived for the Health Home Care Management Program, and this includes individuals receiving assisted outpatient treatment or AOT. You can go to the next. We wanted to cover a couple of the top FAQs. Just to reiterate, as you have heard, verbal consent is allowable during the disaster emergency period, and we have asked that providers document this consent in the client record. Does the telehealth guidance issued during the disaster emergency include HCBS, Adult Behavioral Health, HCBS, ACT, and PROS providers? Yes, and we've said that, but we want to be clear because there's different provider types within all those programs. Amy and Gary have emphasized that we have expanded the definition of provider types who can do telemental health during the disaster emergency period, but we are especially giving a shout out here to these programs that employ a lot of different provider or practitioner types. You can go on to the next. Once again, face-to-face requirements for the DOH Health Home Care Management Program have been waived. We hear mostly questions around the Health Home Plus group where there are or were face-to-face requirements prior to this that were required and have been in fact waived. And of course, individuals receiving AOT, and we say where clinically appropriate. And lastly, should providers use the GT or 95 modifiers only when both audio and video telecommunications are used? No. During the disaster emergency, providers must use the GT or 95 modifiers for either telephonic or video provision of services, despite the modifier definitions requiring video. And we have some pretty specific guidance to that end as well. And you can move on. Okay, and for questions, I'm going to turn it back over to McTack.
Okay,
Thank you so much. I'm sorry, I was double muted. I didn't realize that. Thanks so much, Nicole. I want to just remind everyone to chat in their questions. I know we've been trying to collect some throughout the webinar, and so I haven't received any just yet, but as we wait for some to come in, just a reminder that we are going to share the recording and the slides from today with everyone who registered. So you'll be receiving an email. This will be posted to the MCTAC website. And the other thing to say, just to thank you, Alyssa, for the plug. I did send out an email earlier this week, which was yesterday. My apologies, the days are blending together, to request any updates from the MCOs around your prior authorization and concurrent review. So if you could respond by close of business tomorrow, MCTAC is going to really try and consolidate and create a consolidated grid with every MCO's information so that this can be available in one place for our providers, very similar to our matrix process. So again, thanks, Alyssa, for reminding folks. And if anyone has any questions, just feel free to also respond to that email to me, and I'm happy to follow up. So thank you for that. Just waiting to see. I'm going to give folks another minute or two to chat in their questions. And we will be here for the next couple minutes just to see if there's any questions that do come in. I don't know if the state folks want to share anything else as we wait for questions to come in.
No, this is Gary. Just if people don't have any questions, that's totally encourage you, as Nicole had said, to check our website for guidance. We get a lot of questions from plans who want state guidance, and we really do make an effort to send out anything we send to the provider to send to the plans as well. But checking our website is a good place to look for that information.
All right, I'm just going to give folks a little bit more time. We haven't gotten any questions just yet, but we've got a little time, so we'll hang out here and wait for some questions to come in. Okay, so we do have a question. This is a question about an inpatient service. So can inpatient psychiatrists do telephonic management? And if our state partners are responding, go ahead, Gary, sorry.
Yeah, I'm just asking if the person is asking specifically about the new telephonic codes that the Department of Health put out in the Medicaid, or were they asking about something else more specifically?
Great. So we will see if they can chat in a clarification to their question. So as we wait for the clarification for that previous question, I might just pop to the next one we got in. Which is, does verbal consent from a patient meet the Medicare consent requirements as well during the COVID crisis?
This is Gary Weiskopf again, and we can't speak on behalf of Medicare. We will look and see if we can find the answer in a Medicare document, but we don't set Medicare policy. Medicare has been changing its policy several times over the last few weeks, and I don't want to misspeak. But again, if the question has been sent in as it is, we'll see if we can find information for the person who asked.
Okay, thank you, Gary. So we'll make sure that this gets sent back to the state for further clarification. We do have a bit of clarification around the first question, so I'll jump back to that. The first question was, can inpatient psychiatrists do telephonic management? The person who asked the question said this is really in general, as many psychiatrists are older and some wards have COVID patients, but discussion of DOH recommendations about managing wards during the epidemic is welcomed, and they have providers who are stressed. So I'm not sure if OMH is able to speak to this now, but if not, we're happy to send this question back to the state for further review.
I would defer to Amy, and if she can't answer the question, then we will talk to others at OMH and DOH and get an answer.
Yeah, thanks, Gary. This is Amy. Inpatient psychiatrists, they're eligible to deliver the services, but there are, for better use of a term, there's rules around coverage needs for inpatient units, so I think we would need to get some clarification on that. I know we have some guidance that's been issued about what constitutes appropriate coverage for an inpatient unit, but just in general, they definitely are eligible to deliver a service in that way. But we can get some more clarification and maybe provide the link for the additional guidance if that would be helpful.
Great. I think that was Amy, so thank you, Amy. All right, our next question was about, I think what Alyssa and I had referenced in terms of the request for MCOs to submit the prior authorization and concurrent review information. So someone, it sounds like, had missed our sentence. So all Alyssa and I said was that there was an email sent out to the MCO partners yesterday and requesting each MCO's updated prior authorization and concurrent review information that MCTAC is collecting and will be compiling into a consolidated kind of grid for behavioral health providers. So I know that MCTAC has a pretty comprehensive list of MCO contacts. So that was the list that this email was distributed to. If you would like to be included on that list, please let us know. But I do know that it was sent out to all of our MCO partners, and we are just gently reminding you on the email to respond to us if you can by close of business Thursday. Okay, so I think I just want to thank all of our state partners who joined and presented today. I'd like to thank the entire MCTAC team who helped kind of run and facilitate this webinar. That does not include myself. It's my colleagues who are running things in the background. I am not thanking myself. And all of our MCO partners who joined. I know they're, as Gary acknowledged and everyone really acknowledged, there's a tremendous amount going on right now. And we appreciate you joining us today for this information, your questions, and welcome any additional questions that you might have after this webinar wraps up. So I hope everyone stays healthy and well, and we hope to connect with you again soon. Take good care, everyone.